Hello, everyone. It's Monday, September the 21st. You know, time seems to move along, but at the same time, time seems to go very, very slowly, especially, with us dealing with this terrible pandemic and all the impacts that are from losing precious lives to the impacts on our families and loved ones, to all the economics, all the school part, all the ability for our kids to get back to halfway normal and everything. There's lots of moving parts, and therefore it moves slow. But I just think so much. I do. I read a chapter in the Bible every night, and to summarize, the reading that I had last night, it talked about that first and foremost we should consult the Bible as our guide, and then it talked about how along the way things can be treacherous and even dangerous, and times can be really tough. But it also said that as we know that God will be our lifeline, and keep climbing, keep moving. And so as it talked further, the Bible was very clear on the fact that it said along the way it can be dangerous, it can suck out all of your energies, and it can be lonely. But the Bible was saying, as you go forward, even though it feels lonely, there is still a great many people with you. And as those people are with you and everything, many of them are with you because of the example that you're portraying. And then it said, just remember that God is your lifeline and God will be with you. And you just keep climbing, and we'll get there. And so I just felt like it was just a wonderful additional lesson to me and to all of us, all of you out there, to keep climbing. Know God is with you. And by your example, there are many, many, many that are climbing also. And so with all that, I tell you this, we have lost an additional 15 West Virginians that kept climbing and kept working and everything, and they're going to really, really be missed, I know. But I want to always, out of respect and everything I can do, I want to read each and every one. The 298th death in West Virginia was a 67-year-old male from Cabell County. The 299th death, a 62-year-old female from Raleigh County. Our 300th death was a 79-year-old female from Raleigh County. Our 301st death, an 81-year-old male from Putnam County. Our 302nd death, a 93-year-old female from Putnam County. Our 303rd death, a 71-year-old female from Kanawha County. Our 304th death, a 78-year-old male from Kanawha County. Our 305th death, a 72-year-old male from Kanawha County. Our 306th death, a 66-year-old male from Mercer County. Our 307th death, a 79-year-old female from Mercer County. Our 308th death, a 48-year-old young man from Hardy County. Our 309th death, a 79-year-old male from Kanawha County. Our 310th death, an 81-year-old female from Putnam County. Our 311th death, an 80-year-old female from Kanawha County. And our 312th death in West Virginia, a 75-year-old male from Kanawha County. Please, please keep them in your thoughts and prayers. Great West Virginians, this is a terrible killer and a terrible pandemic we're dealing with, but we're fighting it every way we can. So in your own way, know that God is your lifeline and keep climbing. Some way, somehow, you and all of us will get through this. But thank you so much. Okay, in regard to our numbers, we had 117 new cases in the last 24 hours, but our daily positivity rate is only 2.03%, which is very good. You know, our cumulative positive cases, you know, now are at 2.73. You know, I hope that will level off and start declining more than you'll ever know. You know, our recovered cases are 10,317. Our active cases are 3,544. You know, that's up 169 cases since Friday. Our hospitalizations are down. We're down to 162 patients. That's down from 175. Our daily effective reproduction rate is at 1.11. We want to get that below 1 for sure. We're the 12th worst in the country, but it's getting better. Today, you know, on our color codes, the counties that are in the red are Putnam and Mingo. The counties in the orange are Mon County, Kanawha County, Fayette County, Boone County, and Logan County. Now, the good part about this is, I don't know about Boone. I don't think Boone ever reached red, but Monongahela, Kanawha, Fayette, and Logan surely did, I think. And so we're coming in the right direction there. And now I want to just add just this. We know that Putnam, Mingo are in the red. Monongahela, Kanawha, Fayette, Boone, and Logan are in the orange. Now, we all get that, don't we? And we all know that there's problems here, and we got to do something about it. The one thing we have got to do to be able to do something about it, we've got to know where the problems are. You'll never, ever get out of any hole unless you know how deep in the hole you are, unless you know where you're at. Now, with that being said, how do we really find out exactly where the problems are and what to do? We test. We test. The more we test, the more we know. How many times have I got to say that? Well, I have said it over and over and over and over. Now, so what we're going to do, and we talked about this an awful lot over the weekend, we've been trying to do this, but evidently we just haven't got it amped up to the levels that we need to have it get it amped up to. So what we're going to do, at my direction, we're going through the National Guard and DHHR and the local health officials. We're going to test in our red and orange counties, and effective immediately, we are going to significantly ramp up the testing in those counties. Now, anytime a county moves orange or red, we have already been trying, but we have not been trying as hard as I think we need to try. Now, with that, here's the problem. Here's the real problem. Not the real problem, but a real problem. First of all, you've got to have the resources and the manpower to be able to pull it off, to be able to do that testing and to continue that testing on a daily or every other day basis in those counties until we get those counties out of the orange and the red. Now, additional testing, everybody should hear this loud and clear. Additional testing significantly will help your numbers. You got two things again. You know, you got the infection rate and the positivity rate. The positivity rate will really move by the additional testing. I encourage all kids as well as adults to go get tested. It is a nothing test. It is absolutely nothing. And so from the standpoint of being able to do it and being able to do it quickly and get out, go get tested, especially if you are in an orange or red county. Now, what would that do? What would it do? Here's what it'll do. Naturally, by the increase in the numbers of testing, it will help you with the color codes in your county. Perfect example of that is Cabell County, by having additional testing, from what I understand from the panel, moved all the way into the green. You know, and so all you have got to do is go do a 10-second test, and absolutely what will it do? It will help you from the standpoint of the color code. But the thing that it will do that is the most significant of all, it will help me. It will help all of us, because it will identify, surely as I'm sitting here, some situations to where we have a person that is absolutely asymptomatic. In other words, that they do not have a clue in the world that they have this disease, but they've got it, and they're walking around spreading it to other people, and then they are spreading it to others, and we can't get your county in the green or the yellow or the orange, because there are problems out there with community spread that keep causing us that issue. Now, how do we find that person or those people? Well, we got to test. And the bottom line of the test is just as simple can be. The more we test, the more we learn. The more we test, the more likely your county is going to come out of the red or the orange, and the more likely, absolutely, somebody is not going to die. It's as simple as that. The more we test, the more likely we are to find somebody or people that have this disease that don't know it. And so the more we test, the more likely we are to find those people. And the reality is just as simple as just this. I just read 15 names. 15 names. Somebody that's got this disease, surely as I'm sitting here, and they don't know it, has the likelihood of absolutely passing this virus on to somebody, whether they be a loved one or whether they be a stranger. Absolutely, they have the likelihood of passing this on, and then somebody's going to die. So, from the standpoint of your county, and you getting in a better color code that enables you to do more, especially go back to school, for crying out loud, we've got to get our kids back in school. You know, it will help in regard to that, but on the other side, it will help all the health officials to be able to identify problems and then address those problems. Help the people that have this and address those problems and get them back in great shape. And not only that, prevent them from being able to spread it to others. Now, the problem with being able to do this, just boom, is just one thing. And that's all there is to it. It's just manpower, and it's also the processing of the testing in itself. The biggest problem that we have is the help of from all the standpoint of the local health officials. They are doing an incredible job, and they're working night and day, and they're worrying on top of that. Now, these people are absolutely heroes in every way. They can't do but so much. And what I want to do is I want to help them in every way to be able to test and test and test and test. And that's what that's our whole objective right now. Absolutely, you should thank your local health department in every way. But in addition to that, we've got to help them with resources and any abilities that I have to be able to help them to be able to continually test our people and everything in especially our orange and our red counties. I'm all in to help them. So it is a monumental task for people that are already doing incredibly good work. And so, but we're going to find a way. We're just going to find a way to continue that testing. Now, you know, today I think we're going to be able to cover all the counties that are in the red and the orange. The but on Mon County, I know on Mon County, from a guard standpoint, WVU is testing, in Mon County, the local, I think WVU or the local health officials are testing at WVU today. I know from the standpoint of the guard and the health officials, we're in Boone, Kanawha, Lincoln, Mingo, and Ohio counties, and Putnam County, the local health department is said that they're going to be ready to go tomorrow, and so we're going to be in Putnam County tomorrow, as well as Cabell, Fayette, and Kanawha counties, and we're just going to just switch, keep moving just as fast as we can on Wednesday in Boone, Mingo, Mon, Putnam, and Wayne counties, and so we're just going to keep testing and keep finding out until we get the problem solved. And the more we test, the more we'll learn. And the faster that you're able to get tested. So please, here's the bottom line. Please, anybody and everybody, especially our kids, but anybody and everybody, because we're missing stuff with our kids. I mean, that's an area that we think, oh, that's all fine, there's no problem there and everything. But there is some problems there. And we know it from the standpoint of the demographic and everything that's coming back on, from 10 to 29, there's people that have it, that don't know they have it, that we need to know. We need to know to be able to help them. And so get them tested, please. From the standpoint of the Bible Center, we've been talking all weekend long. The National Guard is now going to be there testing today. And they're going to test all the students in the school, all the faculty, and all the staff. That is an incredible offer that has come from the Bible Center, and we thank them for it. And we're continuing to work with them, on their school openings and reopening plan. And we're going to get through this in a hospitable way. But we thank them for stepping up. I mean, they have really, really done well in stepping up for all of the county, and with all this, it should just make things safer and better. But from the standpoint of a private school, stepping up and saying, we want to test every student. We're going to test every student, all the staff, all the administration, everybody, and so I think that's really great, and I appreciate them doing it. From the standpoint of our long-term care facilities, we have 38 outbreaks in our long-term care facilities now. Our churches have 6 outbreaks. That's down a little bit, but they're in Harrison, Nicholas, Fayette, Mingo, Kanawha, and Wayne counties. And I strongly, again, urge everyone to use those guidelines that are on the website. Absolutely, that's super important. From a corrections update, we're down to 9 positives now at Mount Olive. We have 16 active staff cases at corrections. 11 of those are at Mount Olive. We continue to test, continue to clean, continue to do all the great work, and thank the National Guard over and over. I can never thank the National Guard enough. They're unbelievable. Just great, great work. From our small business grant program, we've now, got out or got set up to go out $18 million. There's 6,900 applications that we have and we're processing. We need absolutely more applications. We're running out of time there. September 30th is the cutoff on that. We sent out $113,587,633.96 to 191 cities and counties. I'm really proud of that and everything, and thank you guys for stepping up and doing your job and getting your applications in, and we're processing, and I know this has been an incredible aid and help to our counties and our cities, and I'm very thankful that we were able to get it out to everyone, and please continue to apply, and we'll continue to send the money out. From the standpoint of our census, West Virginia is now counted at 99.6%. Idaho is at 99.8%. So we're in a race to see who's going to be first, and or tied for first or whatever. Like I said before, some way somehow, help me just a little bit more. You've done fabulous. So gracious sakes, West Virginia is so good. You're so good. So proud of you. We got 10 days left to respond, and then that's that. You know, on Friday, we lost a Supreme Court justice. Ruth Bader Ginsburg has made a contribution to this country like a few others, but not like tons and tons of others. You know, her dedication to public service is unbelievable. And what she's done for this country will have a profound impact forever. You know, she'll really be missed, and so I offer up our prayers. Kathy and I offer up all the state's prayers. And I want to read this one thing. I've issued a proclamation in accordance with President Trump's proclamation, ordering that all United States and West Virginia flags on all state-owned facilities throughout the state be displayed at half-staff until the day of her burial. So a great, great, great American, a great American. She'll really be missed, and so please keep her and her family in your prayers. From the standpoint of Game Changer had their summit today. You know, if you missed it, you know, as a kid, you got to pick up, you know, when they rerun it, it went just great. You know, they honored me in many ways to allow me to be their head coach, and I surely did my part from a virtual standpoint, and so I just believe that this is another tool in the toolbox, and a significant tool to really be able to motivate our kids to move on and be leaders and absolutely be examples of goodness. You know, remember what I said from the Bible, you know, just think about that trip up the mountain. It's tough. It's really tough. And if you're a kid watching this, your trip up the mountain right now may be cluttered with some type of drug type issue or whatever. You may have any type of issue going on. But that trip up the mountain's tough, and you get tired, and absolutely you get beat up. And it's really tough from the standpoint that you just feel like, well, nobody's with you. But I'm going to tell you just as straight up as I can tell you. As you make that trip up the mountain, others are watching you. And as you continue to trudge on and go on to get to the peak, you'll never, ever get to the peak of the mountain if you don't continue to go on. So as you continue on, others are watching you, and you become an example of goodness. So much depends on what you're going to do. And so this Game Changers, stuff is really just an aid and an example to be able to help you. But remember, as you're going up that mountain and it gets lonely and you get tired and it gets really, really tough, God is right with you, giving you a lifeline to be able to make it to the peak. And so just keep climbing. I can't be more proud of all that we're doing with Game Changer. I can't be more proud of all that we're doing within this state. And it's tough stuff. That's all there is to it. So just keep at it. Now let me tell you a really, really good story, and then I'll be done. A man from Tennessee came to West Virginia to kayak, and he was kayaking on the Kanawha River in Fayette County, where Kanawha Falls is. You know, then he didn't show up, and there wasn't any sign of him anywhere. And they looked and looked and looked, and basically people thought, well, he's drowned. He's drowned for sure. We've lost him. And so there was an individual, Corey Lilly, that came forward from Fayette County and said, there's a spot near the falls, or at the falls, and there's a waterfall in the river. And there's a deep crevice in the rocks there and everything, and it's a treacherous place if you're going through that you could get trapped there. So he and the DNR police went there, and they went to that spot, and sure enough, here's the kayaker. And he's hollering for help, and he's experiencing hypothermia. And at 1 a.m. this morning, they rescued him. Again, isn't it unbelievable? Unbelievable how our first responders respond and run to the fire. They do it, and they do it, and they do it. Corey Lilly helped them, but then they ran to the fire. And lo and behold, this man is expected to make a full recovery where he was trapped and would surely have passed away. You know, I can never say enough, and I want to just add just this. And maybe I'll get in a little bit of trouble here, but if I do, who cares? You know, for this movement across our country to defund the police, are you kidding me? To defund our first responders, who do you call? Who do you call? That's the bottom line to me. You get in trouble, who do you call? You call the very, very people that are willing, with not much pay and a lot of times nowhere close to the appreciation level that we should give them, they're willing to run to the fire. You saved a life here. What's a life worth? Absolutely. You can't measure it. Nobody can measure it. Please take time to be thankful to all the people that are absolutely out there putting in the licks and working really hard every day. Now, we all know. They know too. From time to time, there's bad eggs, and we need to some way separate the bad eggs. But for the most part, they do an amazing job. And absolutely, I thank them from the bottom of my heart. That's really all I've got, but keep all those in your prayers we've lost, and keep our Supreme Court justice, and please just keep all West Virginians in your prayers.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I want to focus my comments today on really what the governor has said, and perhaps maybe add a couple of my own take on things. So we have recently changed the way that we are assessing each county. As we said at the beginning of this pandemic, that we're going to go from a single state's focus to 55 counties, individual focus, so that we could work on living with COVID-19 and trying to safely open up businesses and open up recreation places and open up schools and open up activities. But remember, this map and our focus is really one that is public health driven. And we have taken a number of insights from the best people in public health, not only in our country, but around the world. We have recently tweaked that model to not just include an infection rate, which didn't take into account the amount of testing. And in fact, what we understood after a while is that, in fact, that metric alone made it less likely that people were going to get tested, because folks had figured out that the way you try to bring your infection rate down is you just don't measure it. But what we saw an increasing amount of infection in the state of West Virginia. We saw our RT rate rise. And I think that given this tweak that the governor really challenged us to do, now with the percent positive rate, as the governor said, we already saw over the weekend where Cabell County went from a gold color by the infection rate and went to a green color by the percent positive rate. So we know that in order to identify people who are spreading COVID-19, then it is really important that we do more tests. And since we have made this change, we've seen those daily number of tests start to pick up, which is really, really good. Good for the people of West Virginia, good for the metrics that can allow each county to start to gain hope that they can open again. And as we've talked about, that percent positive rate of under 5% is really a target of the Centers for Disease Control, the World Health Organization, and many other oversight bodies that's made recommendations about safely opening schools. But I want to finish my comments and say this. You know, the governor told a great story about our first responders and about our citizens who care for each other, and identified that treacherous part of the river that the Kayaker got stuck in. But think about this from an extended way. So every time you wear your mask and you physically distance and you stay away from crowds and you keep yourself healthy, you wash your hands, you are protecting yourself. And just like the first responders did, you're saving people's lives, because we know that it's not just about you not getting sick, and that's important to us. We don't want anyone to get sick from COVID-19, but it's really about you protecting yourself so that you protect other people. And the governor has read the names of people and the ages of people and where they've died for the COVID-19 pandemic. And our commitment is to each West Virginian that we want this to be the safest, best place for people to live. So by wearing your mask, by doing the things that you know protect yourself from getting COVID-19, you're not just protecting yourself, you're actually saving lives. And so as we go forward and continue to work together to test broadly, to identify people who are asymptomatically or pre-symptomatically infected, also think about it's not just our responsibility to do the right thing for people in our community, but it's really another way that each citizen can run to the fire, can make their own contribution to saving the lives of others. And that is something that is worth making that effort to do. So we thank each one of the folks watching this, and to the rest of our citizens, certainly our first responders, but let's continue to rally together, West Virginia, so that we can continue to be a model, but that we can save lives and save lives together. Thank you.
Thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor outlined at his direction, we have all of our available additional assets focused on supporting our local health departments and DHHR in the orange and red counties, and we'll also begin to expand out into gold counties eventually. That's 359 National Guard personnel that we have on duty today, working various activities. In addition, significant work going on with our partners at Corrections to finish the sanitization missions at Mount Olive Correctional Facility. In addition, a lot of work going on related to rolling out additional broadband support. And Jordan, if we have the slide, if we could put that up, show National Guard locations that have already added broadband support and will be adding that support.
I don't have it, but we'll put it on our website, General.
We'll get it up on the website for those who need it. And then the last thing I would leave you with, significant focus by the National Guard over the next 2 weeks to ensure that all of our members of the Guard, as well as their families, get their flu shot. We have to stay healthy to be able to, as the governor says, run to the fire and respond when necessary. We're going to make a significant effort on flu shots, as well as continued COVID testing of our force to make sure that we are able to respond when necessary. Thank you.
All right, thank you, General. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. One quick update. Last week, we became aware of some fire departments in the state who were not meeting applicable licensure requirements. This came to the attention of the West Virginia Office of Emergency Medical Services in refilling an order for medication. It was during this process that it was realized that the entity was not operating under the appropriate license. A memo was sent Thursday to these entities to make sure that was clear and to cease that practice. On Saturday, after carefully reviewing that matter, the West Virginia Office of Emergency Medical Services rescinded that initial memo and will work in an expedited manner with these agencies to assist them in reviewing any required licensure requirements. It's important to note that the individuals providing the services in question are qualified and certified individuals. These are EMTs. It's the fact that the fire departments were not licensed themselves under the applicable statute that places certain requirements on them, such as working under the direction of a medical director. So we've already received multiple calls from fire departments throughout the state who are interested in meeting these requirements and becoming licensed and making sure that they meet all those requirements. We also want to state that the well-being of the public is of utmost importance, and we would like to ensure that the rules are being followed to continue to keep communities safe and healthy. We're very dependent and thankful on our first responders throughout the state who keep us all safe and who are there for us in emergency situations. We never want to impede their efforts to perform life-saving procedures when those are needed. So we'll be working closely with those fire departments and to meet the applicable licensure requirements under the code. Thank you.
All right, thank you both. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you've previously talked about the limits of the state's testing capacity. You know, back when I asked about if we could test all the students in school, you said the state couldn't do that. But now we're talking about an expanded testing effort. So I was hoping you could address the limits. What is our daily capacity? Is there a benchmark that we're trying to get to? And how do we get to, bridge the gap between those two numbers? Thank you.
Okay, Charles, I'm going to lead off and then I'm going to pass, I think, to the National Guard, to General Hoyer. But I think, without any question, General Hoyer, believes that we need a very minimum of 7,000 tests a day. And we've been percolating along at 3,500 or whatever. And really and truly what happened was a lot of people decided, well, we're not going to test because if we test, that hits our infection rate, and we didn't have the other side of the equation put together for them to be able to be encouraged to test. So basically what happened, which is ridiculous, because the bottom line to the testing is to find people that are positive. So people probably weren't thinking about that the right way, and we could have come up with, someone came up with the idea of how we could do it in, two ways and let it be either or. But the bottom line, as I understand it, is just under 10,000. And if we could get to 10,000 tests a day, I think that's our maximum level. And maybe Bill and General Hoyer can comment on it. But I think we need to be right at or just barely under 10,000 a day. But if y'all could jump in, please.
Yes, sir, Governor. As Governor pointed out, we've been going over the last couple of weeks at about 3,500 to 4,000 or less than 4,000 a day. This past week, it went up to over 4,600. The objective is a minimum of 7,000. And as the governor said, Dr. Marsh, Secretary Crouch, the team at DHHR, Dr. Amjad, a number of us have worked these numbers over the past month and a half, and some great work by Commissioner Mullen within DHHR to look at numbers. And the objective would be a minimum of 7,000. DHHR has worked significantly, and I'll let Secretary Crouch address the work being done to increase lab capacity as well as lab throughput, and that along with the support needed to local health departments and local administrators of the testing are the key issues that we continue to focus on. So, Bill, I'll turn it over for you for further comments.
Thank you, General. Yeah, we have added a significant number of labs to our testing arsenal here. We have a capacity now that is a little over 10,000, we believe, a day. So we have increased that significantly. Part of the issue there is the same issue we dealt with initially, which is to make sure those labs are connected electronically. We have labs who come on board through contracts, not with DHHR, but with local health departments or hospitals or others out there, FQHCs, et cetera. We've had a few instances where we've discovered that those labs aren't connected because we end up with fax copies on a desk at a local health department, and we're working hard to make sure all of those labs are connected to DHHR so that we get a quick response. There's a lot of discussion about why do the numbers differ in terms of local and state, and again, that information goes to local health departments. Our cutoff is at midnight, so what we have on midnight is what goes on the dashboard. But the numbers are increasing, as General Hoyer said, and we're pushing hard to make testing a priority for red, orange, and gold in other counties. So we will be continuing that as the governor's requested. Thank you.
All right, thank you, Charles. Next is Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. For a couple of weekends now, I've had conversations with our weekend editors looking at the various maps, and they're having the same confusion that I would imagine that a lot of parents and a lot of people are having in regards to, in essence, we have one map, but it's in two different spots, DHHR's daily updated map, and then of course we have the map that's put online at 5 p.m. Saturday out on the Department of Education's website, which is the map that ultimately parents and school administrators and teachers go off of. But it's also confusing considering that many times the map Saturday morning is vastly different than on the DHHR website, is vastly different than the map on the Department of Education website. Now, I know that the health experts look at all the numbers and help put together the Department of Education map ultimately, but it appears that we just have ultimately these are two separate maps, even though at the end of the day, they use the same exact criteria, they use the same exact data, though one is more, I don't want to say massaged, but thoroughly looked at by health officials. Would it not be better just to have one map versus have two maps that sometimes contradict each other? What are the thoughts on that? Thank you.
Let me take it, Stephen. Let me just say this. Without any question in my mind, it'd be better to just have one map. But here's the problem. Here's the obvious problem. You know, in being able to give people proper notification and everything else, you know, of where they're going to be in regard to school or athletics or whatever, you know, people, we feel like from the, you know, the SSAC and the education community and our health community and everything, they have made recommendations to me that we go with a date, and that date influences the next week, and that's Saturday night, okay? Now, in addition to that, what we've tried to do in complete transparency is we've tried to give you a daily map that is an update every day that the DHHR is doing. The maps are different, and there's no way that we can do the work and make the map the same every day. Now, we can take off the DHHR map and just go with the one map that our panel scrubs and takes all the input from the DHHR and then scrubs like crazy and come out with one map a week, and boom, that comes out on Saturday night. Now, but in an effort of complete transparency of what I think the people want, and I understand the confusion, that's easy because the maps are going to be different until the panel trues it up on Saturday night. But I think the mapping coming out every day gives you an indication and an indicator. But it is just that. It is just an indicator to the mapping that's coming out through the SSAC and Department of Ed and the DHHR and the National Guard and the panel and everybody that's trying to bring that map out to you on Saturday night. Now that's the problem. And you know, what we're trying to do is to answer to both ends of the problem, and that is come out with a map that our panel truly massages and makes as very best they possibly can on Saturday night, because all of us want our kids to be back in school, you know, and in doing that, you're going to have a different, if you have complete transparency, you've got to have a different mapping, and it can be different on Saturday morning, and it can be different every day, because it changes that fast and everything. But if you're going to be completely transparent right now, I mean, you know, we've talked about this 50 times because, you know, they are different, and it is going to lead to some level of confusion, but to be completely transparent and to do it the right way, I don't know any other way we can do it.
All right, thank you, Steve. We have a new reporter joining us again today. It's Matthew Young with West Virginia Daily News.
Hey, good afternoon, Matthew Young with the West Virginia Daily News. If I could just piggyback off that previous question there, just for some clarification. So when parents and school officials are making their determinations for the school week, the map that's coming out from the Department of Education website Saturday evening, that is the definitive source that we're using when making a decision for Monday morning. Is that correct? Thank you.
If parents are making decisions in reference to or in regard to school and everything, or in regard to sports, the map that comes out on Saturday night is the map that they should be dialed into and look at from the standpoint of making their plans for the following week. That's correct. Now, however, as we come out every day, we're trying to give you an update, an indicator. If you're looking at that map for school or athletics or whatever, and you're looking at that map, the map that's coming out every day is an indicator for that. And in addition to that, please just take advantage of what we're trying to tell you, and that is this. We want you in school. We want you to be playing athletics. We want everything there, but we want it to be safe. And to be safe, we've got to be able to test and find out, if there is a person that's walking around and or people that are walking around asymptomatic that we can say, we need you to self-quarantine here for 2 weeks or whatever it may be, and get yourself in great shape and everything else, and quit being, out all over the place that you're infecting other people. It is just as simple as that. But to do that, we got to test. And right now we're testing 3,500, and we want to test 10,000. We want to test 7,000 minimum. So we're testing half of what we need to test. But in addition to that, if we wanted to test 10,000, we're testing a third of what we need to test. And so we got to test a lot more people. You have got now, as West Virginians, as parents, as the absolute greatest people that I know you are on this planet, you have got to encourage the kids as well as yourself, and get out and get tested. We're trying to provide the sources and the manpower for you to be able to get tested. Now you have got to go get tested, and it will just help us. It's so painless. It will help you from the standpoint of planning and your color coding in the counties, but it will help us more than anything to identify sources of problems, to be able to stop this thing and stop it in its tracks. But you got to help us, and you got to go get tested.
All right, thank you, Matthew. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. Mark Curtis, Nexstar Media. I'm curious about retesting. Many of us have been exposed to people who were positive, so we got tested, and that's all well and good. And people need to be retested because obviously the first test is just at one moment in time.
Mark, I'm all in about people getting retested. From the standpoint of how we handle it and everything, we've got to be able to have the resources. We got the resources. We got the money to be able to do it. The problem is just having the manpower and really helping the local health officials, because gosh knows, I know they're worn out and everything, and I know they're doing great work. But Clay, maybe you could jump in on the retesting comment, but I'm all in on any level of testing. So Clay, jump in.
Thank you, Governor, and thank you, Mark. What we want people to do is to feel very welcome, particularly in counties that have a lot of activity, like the red counties, the orange counties, and working to the gold counties, for people to show up at these testing events, or as we are able to create more stable testing areas within the state, to come and get tested. Certainly if you get exposed to contact, then the local health officers will notify you and direct you to do that. But we certainly welcome everybody to get tested. And the more we test, the more we find, as the governor said. So absolutely, when we have these screening events show up in your community, then come out. We want people to be tested.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I want to ask about who is showing up for the testing now. Is there a particular age group that is not showing up as much as they should? Could you give us a demographic look at that? Are young people staying away because they may think they're asymptomatic and may not think that they've been exposed to anybody? What is that looking like? What's a typical testing site look like?
Let me comment, and then I'm going to pass to Dr. Amjad. But let me say this, Paul. You know, I got a call yesterday. I loved it. I loved it. It's a gentleman from down in Putnam County, and you know, I've tried to always not name names and everything, but he talked to me, you know, about the additional testing and additional testing need and everything, and I really appreciate the call and everything. But the one thing that he said is, he said, you know, when the testing was down here on Friday, he said, I took my kids and we all went and got tested. And we all, you know, it all came back and it was all negative, but he said this, and this is what I loved. He said, you know, he said, I took off work. I thought, well, how long is this going to take? And it's going to take so long. He said, I was actually gone from work 13 minutes. And he said, and from the standpoint of the ease with the kids and everything, he said it was great. So Dr. Amjad could tell you more about the demographic, but we sure need a whole lot more kids to be tested. We need to flood these testing sites with people and everything, and just like we did, just exactly like we did in getting counted in the census. Right now, if we want this thing, you know, to get out of our lives, the biggest tool that we have, other than wearing masks, you've got to wear your mask. But the biggest single tool in the toolbox right now, without any questions, being tested. Because absolutely, if we test like crazy, we'll identify this person and this person and this person, and we'll let them be self-quarantined or quarantined, and we'll talk to who all the people that they were in contact with, and we'll do the contact tracing, and then lo and behold, bingo, we have got it. But we can't do it unless you really help me and get out and get tested. Amjad, if you want to tell them the demographic, I probably ran my mouth too much.
Sure. Hi, Paul. Sure. It does depend on the local health department's area, of course. So, of course, in college towns, we're seeing a lot more college area people be tested. We do not see a lot of young kids being tested, elementary school age. But looking at our demographic page, we do have a lot more females being tested. We have had some issues with the timing of being tested. You know, we do have a lot of community events. A lot of people are at work during the time, but we are seeing anywhere between 30 to 50-year-olds being tested, and not a lot of young people. So we do encourage young people being tested, elementary to high school kids and that age group, as we've mentioned, but more women rather than men. We have not seen a large minority population being tested, which we are encouraging as well. But we do want some younger people being tested and more men. It looks like we have less than 40% of males being tested. So we'd like all age groups to be tested in the younger population.
All right, thank you, Paul. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor or Dr. Marsh or Dr. Amjad or Secretary Crouch, I don't know who would handle this, but have you guys gotten a handle on the multiple testing positives of people across the state whose jobs require them to be negative with a test before they can come back to work? I know that you said you were going to look into that. Have we drilled down into that? And how exactly could we stop that from polluting the numbers that we're getting? What standards and methods could you put in place to avoid that? Thank you.
Okay, Secretary Crouch, you've got to answer this. You know, I've had multiple conversations with you about it. I know you guys are trying hard, but but hopefully you can tell, Kenny, something that's more definitive than just trying hard, because, I mean, everybody that's listening and everybody that's watching needs to know that, and growing up in my house, my dad would always say, don't confuse effort with accomplishment. So that means just trying hard isn't good enough. You got to achieve. And so Secretary Crouch, if you could comment on that, please.
Yes, sir, Governor. We have been able to pull out duplicates, and we have also pulled out congregate cases on the calculation of our positivity rates. So we're working to put that up on a separate tab in the next couple of days on the dashboard, so that everyone has access to that. Again, trying to be very transparent. One of the things we're trying, we have another balance here of not keeping individuals thinking they shouldn't test. We want people to test. It's making sure that those duplicates are not counted over and over again. And we have gotten to the point where we, now that we have pulled those out, and we'll have that information up very shortly.
All right, thank you, Kenny. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. I get questions, as you probably do, from the public about the calculations that go into the dominant Saturday map. People want more explanation about those numbers, the data that becomes the map. Do you think that at some point it would generate more confidence if you can show your work like children are supposed to do on their homework? Thank you.
Brad, I think I would love for people to see the level of the work, and showing my homework would be great, and showing all the panel's homework and all the input that goes into DHHR, but that's really, really difficult to do. But Dr. Marsh, I mean, I have removed myself from the standpoint of the panel. I get a report on what the panel has recommended. I probably do have veto power and everything, to step in or at least add some input to it. But I really try to not take a different course, and I haven't. And so if Dr. Marsh could probably comment, because he calls me after the panel has made their recommendations and gives me those recommendations, and when he calls, I approve. But anyway, Dr. Marsh, maybe you could add something.
Sure. Thank you, Governor, and thank you, Brad. So as the Governor pointed out, there is a clear process that we have been following. And just to review the process, so the data that we are assessing for that Saturday map is the data that is up to midnight on Thursday night. On Friday, the DHHR epidemiology folks contact local health departments and make sure that the data is verified for community versus congregate, for duplicates, as Kenny Bass just asked about, and for county of origin, so that we're allocating the appropriate cases to the counties. We are also starting to look now at the incidence, the infection rate, and the percent positive rate, as we've talked about, and have allocated these rates to both to red, orange, now gold, yellow, and green counties. On Saturday morning, after the data is verified and then tabulated, we have the panel that meets. And this past weekend, we made 3 adjustments. And I want to be clear, we're not just making things up based on what we think should happen. We're really looking at the accuracy of the application of the data. That's all we're doing. And so there was 3 changes, and those 3 changes were all made out of counties that started off gold. The first one was Cabell County. Cabell County had a percent positive rate that was under 3% for both the 7 and 14-day rolling averages. So by that criteria, they moved to a green color. Lincoln County, which was gold, had an issue with the number of total cases that were done in their assessment. They had less than 20 cases, and as we've talked about from the standpoint of the appropriate public health approach. If you have less than 20 cases using anything of a rate, that's an insufficient number. So we then went from a 7-day rolling average to a 14-day rolling average of the infection rate, and they moved down to a yellow color, so that was the recommendation. And in Pocahontas County, there was a single group of people that had gotten infected, and we rechecked, and that was an isolated group. Local health department basically felt things were under control, and then we re-reviewed the time in which they had been in isolation, and we had found that a group of these people were able to be marked as recovered as opposed to active cases. And with that changed the color coding. So those were the 3 changes, none of which were things that we made just by our own decision point. It was really asking about how that data was applied and making sure that we were applying it accurately. So thank you.
Gordon, come back to me just one second. Was that David that asked the question?
It was Brad McElhenney.
Oh, Brad. Okay, Brad. Brad, I'm willing to do this if you didn't get all that, and I know, I know you probably got every bit of it and everything, but I'm willing to have Dr. Marsh even go back through it one more time, because the amount of input and the amount of work that goes in to making these decisions and deciding on the map and everything else is astronomical. And these great people are doing that work. And this is not something on a whim. It's absolutely done with math and scientific, and it's done with all the good work of the people. So Brad, if you've got any follow-up question in regard to that, I want you to ask it, and ask it now, because I want everybody to hear what Dr. Marsh has already said, because as soon as he calls me, he goes through every bit of this stuff, with me also. And because if I have a disagreement or whatever, I'm surely going to voice that. But Brad, if you got a follow-up, I think it's a great question to know, and let the parents absolutely know the magnitude of the work that's done by great people to be able to come to these colors. So Brad, have you got anything follow up to anything there?
Hi. I think I understand the process, although I think maybe people who don't regularly watch these sessions would benefit from sort of having it spelled out in writing, maybe on one of the websites. Here's what we do and the process that we go through. But I think what I hear from the public is more wanting to be able to see the math, to see the numbers that go in, the congregate settings that are removed, the duplications that are removed, and then how the final numbers are achieved from there. Thank you.
Okay, well, my whole team, especially Dr. Marsh, you hear all this and everything. If we can make things better, or we can put more things up on the website, let's do it. And again, 100% transparency is wonderful stuff to me. So Dr. Marsh and everybody, if we can make things better, make them better. If you think what we got, is there's a way to report it on the website, in a way that gives people more, confidence and security levels and everything, do it.
Thank you, Governor. Thank you, Brad.
All right, next we'll go to David Beard with the Dominion Post.
Hi, this is David Beard. I have a question for some people who are hesitant to get tested. And the question is, what do you do after you get tested while you're waiting for however many days it takes to get the results? Do you just go about your daily business, or do you have to go into some kind of a quarantine and cancel any medical appointments you have or whatever else might be on your agenda? Or is it somewhere in between? Thanks.
David, I'm gonna let Dr. Amjad, comment on this, but really and truly, we want to get those tests back fast, and really fast, and we're working to have the test results back very quickly. And but Dr. Amjad, if you could jump in, please.
David, we'd like you don't have to, hibernate at home or anything, but we do want you to stay at home and wait for your test results. ideally we want the test results to come back as soon as possible. So, hopefully within 2 to 3 days if possible. But if you do need to go out for something essential, then you definitely need to wear your mask and stay, 6 feet away from people. But ideally, we do want you to stay home and wait for the results to come back, because if it were to come out positive, we don't want to have to go back and have to contact trace anyone that you might have been around. But if you do need to go out for essential services, definitely wear your mask. But staying home is the best solution for that.
Jordan, come back to me. Or Clay, were you going to jump in?
Yeah, let me just add one thing, David. It's really that balance between these public health recommendations on screening, testing, as we are in these counties, and the appropriate quarantining to be careful, as Dr. Amjad said. And I think that what we would all agree with, and I would ask you to, if you disagree, fine. But I think that what we really want, David, is we want people to show up to these testing, screening places. And the more people that can show up, the better. And we would ask people to take care and to be smart. But if you're showing up just because you want to know and you have had no exposures, et cetera, and you're hesitant to show up because you go, oh, I can't really stay quarantined, then I think with the appropriate precautions, wearing a mask and staying physically distanced and all that, we would still say show up. Show up, get tested, but be smart. And as you're waiting for that test to come back, then make sure that you are protecting yourself and protecting other people. Ina, would that be reasonable?
I mean, if you have symptoms, you'd want to stay home. But if you're not having symptoms, David, then you would go ahead and go about your business. If you're having symptoms, then stay home. But if you're not, then yes, go about your business. It's not that we want people to not get tested because they think they need to stay home and not do anything. That's not the message we want to send out either. But if you're having symptoms and you're getting tested, then you need to wait and stay home.
Back to me. Okay, I want to make sure everybody really understands, because this is exactly what I was going to say. Naturally, Dr. Amjad would be saying, if you show up to get tested and you're showing up because you're feeling bad, well, if you're feeling bad, we absolutely, once you're tested, we absolutely need you to go home and stay at home. But if you're showing up to get tested from the standpoint of helping us find somebody that's walking around that's asymptomatic, we don't want you to go home. Naturally, I guess it'd be good if you just went home and everything, but absolutely, if you'll just wear your mask and come and get tested. We have got to have people come in masses to get tested to be able to find the hot spots and the problems. So we'll deal with the contact tracing. You come and get tested, wear your mask, absolutely protect yourself in every way. In some way, somehow, we've got to have people come out in numbers and get tested. So just, is that okay with everybody, Dr. Marsh? I think that's what you said. I think Dr. Amjad's saying the same thing.
Yes, I just think, Governor, what you just pointed out is we really want people to be tested. And so if you don't have any exposures and you have no symptoms, be smart, protect yourself, but show up and get tested.
Amjad, are you good with that too?
Yes. If you have symptoms, you get tested and stay home. If you don't, then yes.
Okay. All right. Let's move forward.
All right. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Regarding testing, I've heard from a few people who said the current free testing site hours tend to be inconvenient, and they would prefer if there was an opportunity for evening testing hours. Is that a possibility in the future?
It's absolutely a possibility with me, Phil, and we need to try to accommodate, and we extended our hours. At one of the testing sites last week to 8 o'clock in the evening, but without any question, it's a very good point, and we need to, we absolutely, I would be all in to do that. It's just, I just don't want to put too much, on all these people. These people are trying every way in the world they possibly can, and they're pushing it to the limit, but we'll try in every way to do that, because I surely understand that the people are working and everything. It's hard for them to get there, and so because it does take a little bit of time, and so we'll follow that and try to get it done.
All right, and one follow-up today from Kenny Bass with WCHS and Fox 11.
Thank you very much for the opportunity to ask a follow-up. This is for Governor Justice, and it's not under your umbrella, but as the chief executive and leading this COVID-19 fight, I wanted to get your opinion on it. Seems to be a lot of unrest at the largest, one of the largest healthcare providers in the state, Charleston Area Medical Center, among their nursing staff members talking about personal protective equipment, about benefits which have been taken away because of monetary concerns, about not having proper room to work, not having proper staffing, just a lot of problems. And the CEO came out and talked with us last week, Dave Ramsey, and then he went the next day and apologized to his staff because he had intimated that they were getting the virus from community spread and not patients, and that set off a firestorm. Just your take on healthcare workers at Charleston Area Medical Center, where they have a big sign that says heroes work here, and yet if they're found to be positive or suspected of it, they have to go home and use their personal time. They don't get that as paid time. They've lost 401k benefits. Their staffing has been cut in some respects. And it, you know, instead of putting a sign up out in front of their hospital, maybe we should treat them a little bit better because of the incredible work they're doing. Can you weigh into that and get into this situation and give your take on that? Thank you, Governor.
Well, Kenny, first and foremost, they are heroes. Secondly, without any question, I would want them to never be in a situation to where they didn't have the proper space, they didn't have the proper PPE, and all those things. No way in the world would I ever want such a thing as that. Now, as far as being aware of all the things that you're telling me from the standpoint of their 401k or their personal time or their leave time or vacation times or whatever like that, I'm completely unaware of any of that and everything because that's not been brought to me. They're a private entity and everything, and they're, but no one has brought that information to me. I'll dig into it and look as best I can, from the standpoint of from the government, telling private entities exactly what they ought to be doing and everything. That becomes problematic. But without any question whatsoever, from my standpoint, they are heroes. From my standpoint, it is ridiculous to think that they're doing stuff without the proper PPE or testing. And from my standpoint, if we can do anything within the government to be able to assist and help from the standpoint of their compensation or whatever it may be, that, if there was a way to assist from, heroes pay or anything like that, naturally I would be for. But from the standpoint of intervening, on a daily basis in regard to their pay or their 401k or all that kind of stuff, the government can't do that.
All right, thank you, Kenny. Governor, back to you.
Well, the only thing I think I can summarize real quickly and just say this: Clay Marsh said earlier that, when I was basically telling you about the parts of the Bible that I read last night, Clay said, that as we're climbing up that mountain individually, you can save lives by doing just the simplest thing, and that's wearing your mask. Wearing your mask, Clay said, gives you the ability to run to the fire, just like the people that saved the guy that was kayaking. You in your own way have the opportunity to run to the fire by wearing your mask, so please do that. Please go get your flu shots. Those are very important as well. Please say a special thanks to all of our first responders, to all those on the nursing staff at CMAC, to all those that are absolutely out there that saved the wonderful fellow, the kayaker, from a sure death. Absolutely, to all those that are there every day. Say a special thanks to them, but say a super special thanks to our National Guard. What they do is beyond belief great. The last thing I'm going to say is real simple, just this. Now I'm appealing to the parents of the kids and everything in the counties that are, especially the counties that are in the red and the orange, go get them tested. The more we test, the more we'll know. Absolutely, it will help as far as the color coding, to those counties. It will help them get in a color to where they can be in school and be with their friends and absolutely doing the right stuff. But where it will help more than anything in the world, it will help us to identify those that are positive at this time, contact trace them, and stop this dreaded killer that's running through our counties and running through especially our elderly people and the people that have given us wisdom. So please try to get out there and get your kids as well as yourself tested. And coaches, you can really help us here. Get your teams tested. You get tested, all your staff. Absolutely, in every way whatsoever, I'm trying with all in me to get you back in school, get you back playing athletics, get you back to as much normal as we possibly can. But more than anything, in doing so, what happens is then Jim Justice doesn't have to sit here and read about 15 people dying. So please go get tested. It's really important, really, really important. God bless each and every one of you. West Virginia, you're superstars in every way, and let's just keep doing it. Thank you so much.